I next invite Dr. Chandrima Paul. She will be speaking on writing a review article and meta-analysis. She will also be speaking on financial disclosures and plagiarism checks. So a very brief introduction for Madam. Dr. Chandrima Paul is one of the very first PhDs in ophthalmology in India. She was the Honorary Secretary of the Glaucoma Society of India and the President of the Kolkata Association of Ophthalmologists. She is the Director of BBI Foundation Hospitals, has authored multiple chapters. She takes keen interest in research and publications, a key opinion leader in the field of glaucoma. She has been doing pioneering work on early diagnosis and progression of glaucoma in whole of Eastern India. She is also an ardent pianist, a popular debater from her school days, and loves traveling, and is very passionate in the love of nature. Over to you, ma'am, for your talk. Thank you.
Good morning, everybody. Thank you, Dr. Shubhranshu, for those very kind words of introduction, and thank you once again for having me in an instruction course. This is an instruction course which I think has done very well in AIOC and is continuing, if I'm not wrong, maybe for the 4th or 5th successive year with the same lot of co-instructors. So congratulations on that note as well. And I take you through writing a review article and meta-analysis, and Dr. Shubhranshu has also asked me to cover a little bit on plagiarism and financial disclosure, since we have one speaker absent, so I'll try my best to do that. So research is creating new knowledge, as you all know, and we've had 3 wonderful speakers just before me talking on data, statistics, and how to write a manuscript. So this is just to set the tone for my meta-analysis and systemic review, where actually there is no pointer here. So where actually meta-analysis and systemic reviews stand. So once you've finished off with all this and you've submitted a paper and your paper is accepted, published, then you have the meta-analysis and the systemic reviews. So literature reviews, systemic reviews, they are the larger lot, and in them come the meta-analyses. So in a review article, literature review is a survey of previously published research, as you all know, and involves reading the selected text in detail and other related texts to present a fair and reasonable evaluation. So in the research article, basically it presents the viewpoint of the author, and in a review article, you have the critic's viewpoint on the author's particular topic. Content is new content for a research article, just the differences between the two, and assessing already published literature, and the length depends on word limit, but review article is generally much shorter than a manuscript. So the objective, to provide a critical evaluation, can identify new potential research areas, can draw new conclusions, and the other considerations as providing a comprehensive foundation on a topic, explain the current state of knowledge, identify gaps in the existing studies, and highlight the main methodologies and the research techniques. So this is the PRISMA statement. It's a 27-item checklist for a review article. So I wouldn't go into the details. It just starts as usual with the title, followed by the structured summary, the rationale for that summary, the objectives, the method as you would go in writing a normal manuscript, and then finally the results, the study selection, characteristics. I won't go into these details because I've had my previous speakers who've really spoken well on all these. Finally, the discussion and the funding. I'll come to the funding part of it right at the end of my talk. So structure of a systemic review, introduction, methods, result, and discussion. It's almost the same, except I told you about the length of the article. Steps of a systemic review. So formulation of researchable questions, select an answerable question, disclosure of studies, databases and keywords, evaluation of its quality, criteria during selection of studies, and finally the synthesis, the methods, interpretation, and the synthesis outcomes. So if you check a review article, if you're doing a review article, you can make a checklist and look if you've covered up all these. Journals aim and scope, define the scope, multiple research engines, whether you've used them, descriptive title and abstract using keywords, an overview of the topic, a critical discussion, further suggestions for your research in your conclusion, and finally you need to do a spell check and a grammar check, and last, plagiarism, which I'll speak on right at the end as well. So review article, to summarize, should be a balanced discussion and evaluation of strengths, weaknesses, and notable features. You've had to have a absolutely no bias attitude when you're writing a review article. So it's more positive than negative, definitely, and negative points first and positive last to give the authors a boost. And if your critic is more negative than positive, you could begin by stating that is good about the idea and then conclude and explain how limited it is in some ways. So that's actually a meta-analysis, what it is. So meta-analysis, moving on from research review, is the history. I won't go into the details of it. So it's a statistical procedure for synthesis of the results of several independent studies, which are combinable. Remember, Dr. Morekar has spoken about these in details, how you actually combine. You cannot compare oranges and apples. You've got to compare apples with apples and oranges with oranges. Observational study of evidence and multiple scientific studies addressing the same question. So again, if you look at that, meta-analysis actually comes even over systemic reviews, because in meta-analysis you've got to pick and choose exactly those studies which actually can be combined together or which actually talk about each other. So going to the Potsdam International Consultation on Meta-Analysis, systemic review or overview, that's the application of scientific strategies. And you have the meta-analysis or the qualitative overview, that's the systemic review that employs statistical methods. So systemic review versus meta-analysis, if you look at that, then in systemic review, you identify and give a critical review of the research studies. Here in meta-analysis, you identify relevant research studies using a defined protocol, discuss the factors that may explain the heterogeneity in the systemic review, and statistical tests study heterogeneity and investigate explanatory variables in meta-analysis. So there's a very subtle difference between the two, but there are differences definitely. In review, you synthesize the knowledge. Here, the statistically summarized results to obtain an overview estimate of the treatment effect. And finally, not all systemic reviews necessarily include meta-analyses, but all meta-analyses are based on systemic review of literature. So the basic steps involved, if you look at that, the specific objective followed by specific inclusion and exclusion criteria, literature search, quality assessment and data collection, finally the sensitivity analysis to test for bias and the analysis of outcome of data, and finally conclusion and recommendations. So applications of meta-analysis, investigation of adverse effects as existing therapies, differential effects on subgroups of patients, selection from among several alternative therapies, and shortening the time between medical research finding and the clinical implementation of, say, new drugs. So the standard outcomes, the size of a difference, however, is influenced by the underlying population value. And as for example, say an antihypertensive drug is likely to have a greater absolute value on blood pressure in overtly hypertensive patients than in borderline hypertensive patients. That's just an example to put it across. And differences are therefore often presented in units of SD. So statistical methods, I'll completely go over it because Dr. Morekar has done absolute justice to that. So two types of models are used to produce summary effect measures, fixed effect model and random effect model. Fixed effect model basically provides a weighted average of the series of study estimates, and a random effect model, our goal is to analyze, and it will be estimated. We estimate the mean and the variance, the underlying population of effective sizes. So the advantages of meta-analysis, well, it's precision, accuracy of estimates, and improved than what the normal manuscript was. And the results can be generalized to a larger population. It can be quantified, hypothesis testing, and summary estimates. And moderators can be included to explain variation, and the presence of publication bias can be investigated. Limitations, every study has its limitations, being perceptible to publication bias. And publication bias here can be done purposefully or accidentally also. And poor designs are also mixed with good ones. So badly conducted meta-analysis is exclusion of relevant studies or inclusion of inadequate studies. You have to be very careful in that. And other than selection bias, there may be wrong estimates or calculation flaws. So This is the Cochrane collaboration which you all know about. I wouldn't go into the details of it, but it's a very useful library which can be used for this. And the steps of systemic review and meta-analysis, I have gone through them already, so I'll just put forward, as I told you earlier on, how it is. Systemic reviews are always have meta-analyses, but meta-analysis can overlap, but might not always have systemic reviews. So tips to help summarize meta-analysis and systemic review. I've already gone through these, so I won't go through this. So your point of view creates your reality. But oh, this is the other presentation. Actually, there is a plagiarism thing. You've it's there.
So, unka presentation.
I'm sorry about this. It's the wrong presentation. The last slides are not there. Just at the end.
ये वाला का 2-3
ये वाला
slide
था
इसमें
ना, slides extra. Yeah.
लीजिए बस.
ये वाला. I'm sorry about switching podiums, but he didn't put the final presentation. So anyway, a few things on plagiarism. You all know what plagiarism is. Plagiarism is the act of using others' words and ideas without proper attribution to the same. Plagiarism is considered a form of intellectual theft and has serious academic consequences. So the types of plagiarism basically are copying, that's the most common, patchwork plagiarism, you know what that is, and paraphrasing plagiarism, like you can pick up a paragraph or a phrase from somebody else's article. Unintentional plagiarism, you might not be aware of it and you just use something which somebody else has used without giving due weightage to that. And there is a plagiarism detection software which can be used. So things are very easy in the days of the internet. So you can actually use this and find out whether your article is picking up, you've picked up things from other articles without giving them a reference. If you've given them a reference, that's absolutely fine. But you haven't given them a reference, then you could actually be pointed out for plagiarism, and that is dangerous. So you need to take care of that. And how to avoid plagiarism is that when you're actually I'm finishing in 2 seconds. So every single instance, you have to be careful whether you're taking the phrases and you've given the author's name who has used those phrases. If you're using quotations, that's also fine. And if it's longer quotations, it's best to give them in a reference. And if you're trying to express somebody else's words, then you should not be using those words which have been written in the particular text from which you're taking it. And whenever you're using your own words to express what somebody else has said, that is fine, that's not plagiarism, but don't use those particular words. And plagiarism is something which you actually can check on the net before you submit your manuscript if you're not aware that how many things you've picked up from other people's articles. And just one slide on financial disclosure, that is, whatever financial disclosure you have, you must actually admit it. Because if you're doing a meta-analysis, a review, or a manuscript writing, and you actually have a collaboration with some company about a drug or a new device that you're actually studying, then you could be caught for conflict of interest. So you actually have to give your financial disclosure very carefully and everything in detail before you actually write an article or meta-analysis or everything that you do. And we have that system. You would see in many of the articles, when you submit a manuscript, they would ask you about conflict of interest. You need to fill up that form and submit it to be absolutely safe. Thank you very much for your attention.
Thank you, Dr. Chandrima Paul.